the main goal of the European Association of Psychosomatic Medicine is to improve the collaboration between researchers, practitioners, and teachers in the field. And for that reason, we created special interest groups. And in these groups, researchers and practitioners meet to plan certain research projects, to conduct research, to establish training programs, and also to have some exchange about different models of patient care. Examples are, for instance, the special interest group on transplantation. They agreed consensus statements on the assessment of transplant patients. Another example is the special interest groups on somatoform disorders. They published a book, a textbook on diagnosis and treatment of medically unexplained symptoms. And a third example would be the special interest group on training in CL psychiatry. This special interest groups developed guidelines and published guidelines on the training of young psychiatrists and also of fellows in CL psychiatry and psychosomatic medicine. So the work of the special interest groups is the core activity of the EAPM, besides the organization of annual scientific conferences. Well, the annual conference is on one side, it's a good possibility to have an exchange face-to-face of researchers to discuss their work, to discuss results of research, to discuss new projects. And it's a kind of get-together, and it's a possibility to attract new researchers, young researchers, to come to the EAPM and to take part in the activities of the EAPM. And we organize the annual conferences every year in another country in Europe to meet researchers from different countries. So in the last years, we also had conferences in Eastern Europe, for instance, in Romania and in Hungary. And this is very important to give those researchers the possibility to travel not too far, to save money, and to expand our projects also to countries where we are not so strong so far. So the next conference in next year will be in Vienna, which is very near to Eastern Europe, and it's a traditional melting point of Middle and Eastern Europe. And in the next year, the conference will be in Poland, in Wrocław. So we are very much looking forward to these two conferences to attract new members to the EAPM too. Well, the story of the European Association of Psychosomatic Medicine, the EAPM, started in 2012. In this year, two organizations merged, two European associations merged. One was the European Association of Consultation Liaison, Psychiatry and Psychosomatics, and the other organization was the European Network of Psychosomatic Medicine. The EACLPB, the Consultation Liaison Association, was founded in the year 1999, and it was an association of consultation liaison psychiatrists and specialists in psychosomatic medicine who started to conduct research on the European level. And the other association was a rather loose association of physicians and psychologists interested in the interplay between somatic and psychological factors in medicine or in medical diseases. And this was quite an old network. It started in the 50s with the first European conferences on psychosomatic medicine. In both organizations, the term psychosomatic emerged. because both associations were interested in this interplay between somatic factors and psychological factors in the development of medical diseases. There is quite a long tradition of psychosomatic medicine in Europe, but also in other countries. There are different routes of this development. One route is a tendency or a movement in internal medicine of physicians who were interested in this interplay between the psychological and the somatic factors, and they wanted to have a theoretical but also practical approach to overcome the split between somatic and psychological factors in the treatment of medical diseases. And the other traditions emerged from psychiatry, where psychiatrists who worked in general hospitals were also interested in these topics, especially in psychiatric comorbidities in medical illness. So these two groups first developed quite independently, but with the development of research, more cooperation emerged, and the consequence was merging these two different traditions and two different groups in the EAPM. So we hope that by creating a joint association of physicians of different specialties, and also including psychologists, CL nurses, epidemiologists, will develop a broader approach in research and clinical practice. Yes, I started as president in 2012. Previously, I was president of the Consultation Liaison Association. I started with the vision that we could create a closer cooperation between all researchers, practitioners and teachers in the field of psychosomatic medicine and consultation liaison psychiatry. And I'm very happy that in these 7 years since the beginning of EAPM, the association grew. We started with a small group of specialists in some European countries, and now we have about 200 individual members, and I think about 12 national associations who are also members of the EAPM in nearly all of the European countries. So we have two kinds of members: the individual members with the full rights. They can vote for the executive council and run for being president or member of the boards, and the members of the national associations who have certain advantages, for instance, a reduced fee for the for the annual conferences. Well, the EAPM itself is an international association, so we have members from nearly all of the European countries except a very few. But we have also members from the US, from Canada, from Australia, from Singapore, even from Iran and some Arab countries. Aside that, we have close collaboration with other associations in the field, like the American Academy of Consultation Liaison Psychiatry, and also the Canadian Academy of Psychosomatic Medicine, or the International College of Psychosomatic Medicine. We regularly organize pre-conferences at the site of the annual scientific conference of the EAPM, and we organize these pre-conferences jointly with other associations like the American Academy of Consultation Liaison Psychiatry or the Canadian Academy. Well, in Europe, this was always research, joint research of researchers in different European countries. So, for instance, the INTERMED project, this is the project of the development of instruments for the assessment of biopsychosocial factors in complex patients. This was emerged from an European international perspective and from European projects where researchers from the Netherlands, from Germany, from England, Spain, Italy, Norway, Austria cooperated. Other projects had their origin in the United States and in England, like the research on collaborative care. But we have also projects between European researchers or jointly with of European researchers with researchers in the US on those topics. I think in the last 20 years, George Engel's biopsychosocial model began to be a new paradigm in medicine and in the training of medical students, and replaced the old biomechanical model. But I think this is not enough. We have to translate theories in psychosomatic medicine into practice. So the development of the already mentioned models of integrated care, especially for patients with chronic diseases and complex illness, extremely important for medicine. And I think a very important task is to train physicians of all specialties to better assess psychosocial factors besides the biological factors in chronically ill patients. This is a huge task for specialists in psychosomatic medicine. Well, the most exciting developments in psychosomatic research, that's difficult to answer. We know quite a lot about correlations between psychosocial factors and somatic factors in the development of medical diseases. But we don't know a lot about pathophysiology and about psychophysiological factors. So I think this is one part of research which is extremely exciting. For instance, psychoneuroimmunological factors or epigenetic factors in the development of diseases, where psychosocial factors play a part or have an influence. The other research that I find very exciting is the research on new models of care. So we need more models of integrated care, of collaborative care. Some of these models were developed, and we need more of this research to see whether such models of integrated care are really effective in different medical diseases and in different settings in the hospital, in the outdoor setting, in general practice. Well, in the EAPM supports to develop training programs for physicians and nurses. Such training programs emerged especially in psycho-oncology, where specialists in CL and psychosomatic medicine started to train oncologists and oncology nurses. Such programs were developed in the UK, in Switzerland, and in Germany. But this is also true for other medical specialties like cardiology, where also programs for cardiologists were developed in Germany, for instance, and also in diabetology, where training programs were established. So this is a future task of EAPM to further develop such training programs. So I'm very happy about the development of the EAPM, particularly that in the last 3 or 4 years, quite a lot of young researchers joined the EAPM and are very active in the organization, in the special interest groups, but also in the executive council of the EAPM. And this makes EAPM not only more attractive for young researchers, but also more productive in research and also in the development of models of care.